Judy, first of all, thank you for interviewing me. And I'm Dr. Joe Fontenot. I'm with Community Services for Vision Rehabilitation in Mobile, Alabama. And I have started and am the founder of Community Services. I started with it in 2003. I am personally visually impaired, and I saw that there was a need for services for people whose vision was impaired, and I have tried to provide services and to help get the American Academy of Ophthalmology to encourage the use and the provision of services, low vision services for people who don't see well. Low vision is very common in the United States. The main cause of it is age-related macular degeneration, which affects millions of people. And there's a lack of awareness of all the help, all the devices, all the training that is available to help these people function better and better. And we're trying to help make people aware of these services, including making the ophthalmologists aware of the need for them to refer their patients who have low vision to low vision rehabilitation services.
Please tell us about Charles Bonnet syndrome and your experience with it.
But Charles Bonnet syndrome is a relatively common syndrome in people who have impaired vision, particularly age-related macular degeneration. And it was first described by Mr. Charles Bonnet, who described it in his grandfather. His grandfather was mentally intact, not impaired in any way, functioning very well for a man of his age, but he would see things that weren't there. He saw a variety of things: horses, cows, other animals, coaches. This was back in the 1700s, prior to automobiles, but he would see different things like that, and they would be there briefly, but they were well visualized. They would be there a few minutes, and they would then go away. He didn't know what they were. He wasn't too excited or alarmed about it. But it's a syndrome that occurs in probably somewhere around 10 to 20% of people who have impaired vision. And of course, many of them are alarmed about it. They'll see something like a person or a building or an automobile that's not there. They know it's not there. They don't know why they're seeing it. And very commonly, they get frustrated, fearful, and very commonly they do not tell their family, their friends. They do not maybe even tell their eye doctor. So he doesn't know that they have this syndrome either. So a lot of people have this, they don't know what it is, and it does worry them. They think they're going crazy. A lot of them do. And it's something that sort of comes and goes. It's not on a regular basis. It tends to occur more when they're quiet, sitting quietly or lying in bed at night. And so if they're busy, concentrating on doing something, it's not as common. But very commonly they have this, they're not aware of it, it does bother them. Once they're told what it is, they're greatly relieved. So I've had many a person, I've asked patients, do you have this syndrome? And I describe to them what it is. And when I tell them it's normal for people who have impaired vision, they're greatly relieved, and a lot of times they'll say, well, thank you so much for telling me this. I've never told any of my other doctors about it. And it doesn't necessarily get worse. Sometimes it'll be there a while and then go away. It might come back later. But the main thing is we tell them that it is normal. It doesn't mean they're going crazy. And very commonly that is a great relief to them.